Dr. Uttam, then jury members, Rajpon Shetty, Premanand Gaonkar, Rauji Parni. Thank you. Light the lamp of So now I request Dr. Kalpana Mahatme, State Program Officer, NVBDCP Goa to welcome and also give a keynote address.
Everybody, respected chief guest for today's function and keynote address speaker, Dr. Ashwani Kumar, Director ICMAR, VCRC Pudducherry, guest of honor, Dr. Sandesh Chodankar, IMA State Vice President, Deputy Director Public Health, Officiating Director, Dr. Rupa Naik, Deputy Director Dr. Ujjwala, OSD to Honorable Health Minister, Dr. Mrs. Rajnanda Desai, Dr. Geeta Deshmukh, Advisor to Honorable Health Minister, Dr. Mohanty, Officer in charge of NIMR, Dr. Umesh, and all the Vector-borne National Vector-borne Disease Control Program, Directorate of Health Services. I would like to extend a warm welcome to all present for this August gathering. This is the annual function, and I am pleased at the enthusiasm shown by attending in large number. Because last moment I had to change the hall from the smaller hall to the bigger hall, and I was worried about the gathering. But I am very pleased that all of you all have come to attend this August gathering, which is your gathering, of course, because you are the one on whose basis we are aiming for malaria elimination. This is a positive sign for creating awareness regarding achieving our target for malaria elimination in the state of Goa. I would also state that we have received an immense response for our poster and reel competition. All are so good, deserving prize. If I could, I would have given prize to all of them. The poster and reels depict the awareness already present among the community. So this year, I am requesting all present here to aim for behavioral change communication, because all of us from the posters and reels, we have realized that all are aware of the preventive and control measures to be undertaken. But what we need now is to modify behavior of the community so that we can achieve our goal. Thank you so much. World Malaria Day, the theme to deliver zero malaria, invest, innovate and implement. World Malaria Day was established on May 2007 by the 60th session of the World Health Assembly, WHO decision-making body. It is an occasion to highlight the need for continued investment and sustained commitments for malaria prevention and control. World Malaria Day presents an opportunity to engage civil society, private sector, community leaders, academic institutions and general public to work for elimination of malaria. Since 2015, 11 countries have been certified by WHO Director General as malaria-free countries. In 2015, Maldives, 2016, Sri Lanka and Kyrgyzstan. In 2018, Paraguay and Uzbekistan. Then 2019, Argentina and Algeria. 2021, China and El Salvador. 2023, they've already been awarded, Azerbaijan and Tajikistan. Now regarding the malaria situation in India, there has been a gradual reduction in malaria cases from 2016 onwards. In 2016, malaria in India, there were 10,87,285 cases, which came down in 2022 to 1,73,975. PF cases have also shown a decline from 7,11,502 to 99,849 in 2022. Similarly, the total deaths in 2016 were 331, which has come down to 64 in 2022. Hence, malaria situation in India is also showing a decreasing trend. Regarding malaria incidence in Goa, there has been a gradual reduction in malaria cases from 5,056 cases in 2009 to 2 cases in the year 2022. Here I am speaking about the indigenous cases, which is to be reduced, which has to come to zero for malaria elimination. But imported cases have also come down from 2,774 in 2017 to 585 in the year 2022. Our API, we have had no deaths since 2018, and our API annual parasite incidence has come down from 3.4 in 2009 to 0.001 in 2022. From this graph, it may be noted that most of the malaria cases are detected during the transmission season, peaking in the month of July and August. And again, there is a rise after October, as once the monsoons are over, the construction activity is in full swing with lot of influx and malaria cases are detected. The Directorate of Goa Public Health Act has helped in detecting malaria cases early and starting treatment promptly, thereby preventing transmission and spillover in the indigenous population. You can appreciate this in this slide, where more the health cards, lesser the indigenous cases. Now regarding the malaria elimination. Malaria elimination means interruption of local transmission, reduction to zero incidence of indigenous cases of a specified malaria parasite, and zero death due to malaria as a result of deliberate activities. Continued measures are required to prevent re-establishment of transmission. Goa is targeting malaria elimination by 2023 as API annual parasitic incidence at the state as well as district level is less than 1 as per Government of India. There has been a gradual reduction in Goa's API annual parasite incidence, which is total positive cases for 1,000 population. In the year 2018, we had API was 0.24 of the state, which came down in 2019 to 0.17. 2020, it came down to 0.07. 2021, 0.06, and 2022 now. Last year it has come down to 0.001. Goa has 34 peripheral health centers. Of these, 17 peripheral health centers are in the north and 17 are in the south. In the year 2022, 32 health centers, 15 in North Goa and 17 in South Goa, have achieved zero indigenous transmission for malaria. Further, I would like to state that till March 2023, all the 34 peripheral health centers have achieved zero indigenous transmission for malaria. Hence, once API at the health centers come less than 1, we have to scale down to sub-center level or village level, which has been done in Goa. That is, in 2018, sub-centers with API more than 1 were 9, which came down to 5 in 2019. 2020, we had 3 sub-centers with API more than 1. 2021, 2 sub-centers. And for 2022, there were none. The API of all the peripheral health centers, including their sub-center, is 0, except in 2022, since we had 2 indigenous cases. The 2 sub-centers, one under PHC Kandolim, Kalangut sub-center, API is 0.07, PHC Kolwai, Sirshe, API is 0.31. Hence, Goa is on the right track towards achievement of malaria elimination. Stratification is done till the sub-center village level. Malaria in Goa is a migrant malaria, depends on the influx. The statistic is very dynamic. As the cases rise, whenever there are large big infrastructure projects come up in the area, you can appreciate it from the table. Hence, at this juncture, I really appreciate the hard work, efforts put in by all our healthcare functionaries in prompt screening of such a big workforce to prevent indigenous transmission and also supervise the anti-larval work at a construction site. So all our healthcare workers really need a pat on their back for our achievement. Our sensitive zones where our efforts have to be focused are major construction sites, migrant settlements in the peri-urban areas, tourism shacks, industrial units and fishing jetties. Here most of the influx are concentrated. Malaria prevalent areas in 2022 are the Shiolim, Parvarim, Kandolim, Chimbel and Margam. In this area, major construction activities, large infrastructure projects are in full swing. We are vigilant in this area. There are a lot of influx here. Goa is committed for micro-level surveillance under which each and every reported case is thoroughly investigated. Specific action including improved case-based surveillance initiated with private sector and community engagement. Here I would like to request the State IMA Vice President for timely notification of vector-borne diseases from private sector for a prompt preventive action. Regular program reviews are being conducted at DHS. State Program Officer in charge of National Vector-Borne Disease Control for DHS is recipient of SCOTCH semi-finalist order of merit for malaria elimination in Goa project. The virtual award function was held on 18 January 2023. This was possible because of the hard work and put in by all the health centers, and I request them to continue the same. Goa's contribution towards malaria elimination is highly valued by Government of India. Hence, State Program Officer was a part of the multidisciplinary team of national experts constituted for drafting of Malaria National Strategic Plan 2023-27, developed by NVBDCP Government of India with WHO support. The data documentation of the state of Goa is appreciated by Government of India. Some of the suggestions regarding uniformity in categorization will be incorporated in the new National Strategic Plan 2023-27. SPO Goa was also included as one of the experts for development of e-learning training module for malaria disease. She was also invited as an expert for joint monitoring mission for elimination of lymphatic filariasis organized by NVBDCP Government of India in collaboration with WHO country office. Factors that could reverse gains achieved are ever-changing pattern and emergence of mosquito resistance to affordable chemicals, parasite resistance to affordable and safe anti-malarial, change in the environmental and climatic condition, human behavior that promote breeding of mosquito. Some of the challenges ahead. There is a hidden sea of asymptomatic malaria carriers among the laborers from high endemic area, which are undiagnosed during the initial screening of health cards, resulting in transmission of malaria. Absence of any process documentation of mega projects in the initial stage for planned preventive strategies to be implemented. If available, then plan can be made for regarding screening of laborers and the anti-larval measures to be undertaken. Tracing and tracking of the labor. Goa being a small state, contractors move the laborers at the various sites from north to south. New areas, new focus. Earlier, laborers along with their families used to reside at the construction site and they were being screened along with the laborers. Now they stay in rented premises at near the villages close to the construction site, hence new focus at the villages. The disease concentrated among highly mobile migrant population, especially in Goa. Innovations in 2022-23, each health center in the state is a reporting unit, 34 health centers having its own unique microplan in place with the facility appropriate strategies for prevention and control of malaria, along with the stratification of malaria foci down to the sub-center village level. Health officer, medical officer in charge of the respective health facilities responsible for mapping of the area, planning, execution of the malaria elimination strategies in the respective areas of jurisdiction with support and guidance from state NVBDCP DHS Goa. Microplan has line listing of constructions, abandoned constructions, kulaghars, dump yards, stone quarries, migrant settlement area, jetties, IDCs, and this is updated quarterly. An action plan prepared accordingly. This microplan is unique for Goa and was appreciated during the review meetings at Government of India. These documents for malaria eliminations. These documents are maintained in the same alphabetical order at all the peripheral health centers. During Government of India review meeting, this uniformity in maintaining the malaria elimination document was also appreciated. Innovations in 2022-23 continue. All imported cases from peripheral health centers are informed on special email with all the relevant details to NVBDCP, DHS. All such imported cases are cross-notified to the concerned SPO of the respective state with a copy to the Director of NVBDC Government of India for preventive actions in the state, in their state, and also all the imported cases as well as the indigenous cases are line listed. Long-lasting insecticide-treated nets are distributed to all the construction workers at the site, also covering high-risk population in the community such as antenatal, migrant hubs, BPL population in high-risk area, free of cost. Directly observed treatment dogs for PFR patients. This is a new initiative, and maintaining documentation regarding which health officer, which health worker has given or which hospital is responsible for the dogs, and the follow-up of each and every malaria case. NVBDCP is also conducting research projects in association with ICMAR to support malaria elimination program. One is the vector binomics. This will give us information regarding seasonal and relative abundance of malaria vectors, breeding habitats, biting habitat, human feeding habitat, resting behavior, infectivity rate, and susceptibility to currently used insecticide. This information will be useful in understanding the impact of existing interventions on disease transmission and to design appropriate vector control strategies. The second study is study on asymptomatic and low density malaria parasite infection in community and its transmission potential in Goa. This is a challenge which I had mentioned earlier. Then one more research we are having with PSM department, GMC, that is community behavior and its determinants in relation to malaria prevention and control. So this will tell us whether the IEC which you are undertaking at present is sufficient, or there are some lacunae, there are some gaps which we need to fill up so that we get behavioral change communication. We are doing a lot of IEC, but what is lacking is BCC, which we need to have this year. Study will be funded, all the research studies will be funded by MERA India. Mobile app based tool will be beneficial for real-time reporting, tracking, monitoring and assisting timely monitoring of the imported cases in the state of Goa. It will improve case management, timely vector control intervention can be initiated. State program officer and NVBDCP will be the administrative controller, contractor will be the point of implementation, and the health center will be the monitoring points. In this app, the contractors of the study area, that is Madgaon, Panji, Kandolim and Kortalim, will be trained regarding working of the app. The contractor will install the app in the mobile phone of the laborer immediately, and the details will be available to the state program officer and in charges of the above health centers. Next day, a team from the health center and personnel from ICMAR will visit the site, and with one brick they will collect the blood. Our health staff will collect for RDT and SMP, whereas an IMR personnel will collect for PCR to rule out any asymptomatic malaria carrier. In case laborer is malaria positive, treatment will be started promptly, and we shall be able to trace the labor if he moves from one place to another, even outside the Goa or even to his native place. But that is a problem for us, and that is a challenge for us to track such laborers. Disease at first will be restricted to the 4 health centers, and later it will be scaled up for all the health centers in Goa. And later maybe we will include genome typing and check for drug resistance in the later stage. Regarding Goa, there are various sections. I will not go through all the sections. Section 70Y, which is mandatory for mandatory screening. Section 75AA, there is fining, 10,000 per patient, and it is not paid. Health officer shall request local authority to suspend the construction license issued. Section 76B, mandatory anti-larval activities to be carried out by the contractors. A fee of ₹10 per square meter is charged for anti-larval activity if it is taken by our workers. Section 76, nuisance created at any site has to be removed by the owner, occupier of the site. Defaulter are served notice, and if not complied, fine of ₹500 is levied. And Section 37, breeding of mosquito is defined as nuisance. Section 40, in case of nuisance which may lead to mosquito breeding, a notice is served to abate the nuisance. And Section 42, if not complied as above, then health officer has the power to disconnect water supply or electricity. Further, health alone will not be in a position to prevent and control and sustain malaria elimination. Hence, intersectoral coordination with other departments is very important. Hence, all these departments should work in coordination for malaria control, like panchayat, municipality, information, education, labor, captain of ports, fisheries, NGOs, and IMA too. These are the various activities conducted by our health centers for
malaria. On the days and off the days, I can see many young faces. To be at this stage of having an elimination mandate for malaria, so there definitely has to be a history where there has been a large cases in Goa. Okay, so let me go way back to the 90s and 80s, and a witness here among all of us is Dr. Rajendra Desai. Ma'am has been there, and Dr. Ashwani Kumar also has been there. So in Goa, there was rapid surge of malaria cases because of rapid urbanization. And this happened because of the construction sites. There was influx of laborers. And to meet the demand of the rising population, the water was not proper. There was insufficient water supply. So the concept came, the syntax tanks. So we had on the roofs, mainly water tanks put without a lid, and people were storing water, and with this there was a tremendous rise of malaria, both falciparum and also vivax. Falciparum was the killer disease, and most of us there as medical officers in the hospital, we could see many cases and deaths due to falciparum malaria, and thank God we do not see it now. And worst of all was Government of India or anybody did not have any plans or clear-cut SOPs or strategies to manage malaria or prevent or control malaria as it is now. And the whole onus of the disease or the epidemic was put on the health department, and they were most responsible for it. Slowly, as the evolution of the healthcare, we came up with clear-cut guidelines. And then we realized that it was a multi-sectoral contribution to the disease where the construction, everybody was involved in it. And with this, after 30-40 years of the disease trajectory, I would like to congratulate each one of you. The contribution has been for last many years. Yes, let me acknowledge the Government of India guidelines, ICMAR and WHO, which those days were not there. Then of course, our state program officers who contributed a lot to it. Then at the periphery, even the laboratory technician did a good job of diagnosing malaria. Pharmacists for giving the correct medicine. Field workers, they are toiling all day long and even night at times. Of course, there has been a long contribution, and I do acknowledge the other line departments or stakeholder, education department, the panchayati or the local bodies, municipal body, agriculture department, everybody for that purpose. The NGOs, of course, have been there for contributions. And of course, the private practitioners for their reporting. So with this, I say that we can achieve a lot if we put in a lot of effort. And this is a good example of it. Nothing is without hard work, okay? We get fruits of our labor, okay? And please be together to work for a cause, okay? With this, I say thank you.
Indian Medical Association plays a key role in malaria control.